Praise God from whom all blessings flow. We're so excited that you joined us on this evening as we are preparing to have this fireside chat conversation concerning long COVID. Now, many of you have joined us on this day because you know that we have been experiencing a very difficult time. Disproportionately Black and brown communities all across this country have dealt with the impacts of COVID-19. Churches, communities, schools, employers, all of us have had to reimagine this world anew. And many of us have had to deal with the impacts of COVID-19 touching our families, our loved ones, and our community writ large. Unfortunately, many did not make it. And we grieve and mourn with each and every one of you, your families, and those who are continually trying to piece back their lives together. But then there are those who were able to survive and are still dealing with the symptoms of COVID-19. Today we want to have that conversation. How do we as a church, how do we as a community work together to address what is to come? Now, throughout this pandemic, we have been so blessed as a church and as a community because even in this moment of difficulty, we've had amazing partnerships. And one of our strongest partnerships and alliances has been with Boston Medical. I'm so excited because during this season, we were blessed to open up a COVID-19 vaccination center here in the basement of 12th Baptist Church. And we were able to vaccinate over 2,400 residents in our community because of that partnership. It was with Boston Medical Center that we walked throughout our community and informed people about COVID-19 and the vaccine and how we combated misinformation throughout this time. And throughout this time as a church, we were blessed to address food insecurity, job insecurity, to support families in transition, and to particularly support those brothers and sisters who are returning home from our carceral system. And because of that, we were able to give over $375,000 away as a church family to our community and to fill the gap. We're in a brand new year. It's 2022, but the work must continue. And that is why we've come here tonight. That is why we've come here today, to have a conversation with experts from BMC, these physicians, these great minds who will help us think through how do we deal with long COVID, what are we to expect, and how do we grow as a community and prayerfully thrive after this difficult experience. With that being said, as we do often in this church, we always open with a word of prayer. And so I will invite you to pray with me as we open this particular fireside chat conversation. And then after that, I want to invite Trina Martin, who will come forward and bring forward greetings from BMC for each and every one of you. Let us go to God in prayer. Heavenly Father, Lord, we thank you for this day. We thank you for life, health, and strength. And we thank you for this opportunity that we are able to come together as a community and to discuss this pandemic and the effects of it on each and every one of us. God, you know how difficult this time has been, but we as people of faith have believed that if we come together in good conscience, trusting in those professionals whom you've blessed with the gifts and the abilities and the talents to inform us, that we can get through this moment. But more importantly, we've trusted in Christ over COVID. And so, God, we ask that you be in our midst, that you allow for this to be a learning experience as a community together, and that you continue to use this moment to inform us, to shape us, and to mold us for the better. Grant unto us your peace in this conversation, and give us your wisdom in which you give us each and every day. We love you and we praise you, and we give you the honor for this opportunity to share as a community. In Jesus Christ's name we pray. Let every heart and mind say amen. At this time, I bring to the microphone Ms. Trina Martin Cherry.
Thank you, Reverend Bodrick. And thank you so much for the partnership that you've extended to Boston Medical Center. I'm Trina Martin Cherry. I'm the Vice President of Community Engagement and External Affairs. You have allowed us, you've given us access to the community by opening your doors of this church so that we could provide vaccines and education and information. And it is our privilege to be here tonight with this esteemed panel to talk about long COVID. So Boston Medical Center continues to provide outreach to the community and provide access to all things so that we are finding paths to eliminate healthcare disparities. Thank you again. We are so proud of our collaboration and our partnership with 12th Baptist Church.
Thank you very much, Trina, and we thank Boston Medical Center for their partnership and for the work that you do each and every day for our communities and the work that we will continue to do. I hope you all are excited because we have a great conversation. I know folks are in tune online, and so we welcome you from Facebook, YouTube, and Instagram, and we welcome you into our sanctuary and to this amazing panel that we have for you today. What we ask is that we're going to have a great Q&A after they give us an amazing presentation, and all we ask you to do is to put those questions in the chat. We have folks who are reviewing the chat live that will get those questions from you to those who are the experts, and we're just asking that you engage. Without further ado, we're going to go ahead and get started. As I've already discussed, this is a conversation around long COVID, and one of the things that we want to make sure that we're doing is talking about the realities. This has been tough for this community, Roxbury, Dorchester, Mattapan, Hyde Park, and Rosendale, those who are in this commonwealth. And we felt the effects as a congregation and as a community. We know people personally. It's affected our families. It's affected folks in our congregation. It's affected folks who are just writ large going to and fro. And the question is, what is long COVID? How do we process this moment? What does it mean? How do we make sure that it's digestible for each and every one of us so that we might make the adjustments necessary to protect our families, to protect our church, to protect our community writ large? And so I'll start with Dr. Zaya Marafe, who's here, who is an expert. I'll let her introduce herself. But we want to start with you, Doc, to kind of help us understand just what does it mean when we discuss long COVID.
Thank you so much for hosting us today, and thank you everyone who's attending online. I'm Dr. Marathe. I am the Clinical Director of Infectious Disease Clinic at Boston Medical Center, and I also am the Director of the Long COVID Clinic at Boston Medical Center. But first and foremost, I'm an infectious disease physician. So, Reverend asked a great question: what is long COVID? So anybody who's recovering from COVID, who continues to have symptoms that are related to their COVID illness for longer than 4 weeks or longer than a month, may actually have long COVID. The symptoms can be mild, so just from sniffles or congestion, to something as severe as still continuing to require oxygen or unable to perform their day-to-day activities. All of those constellation of symptoms may actually be long COVID. Also, there are some common symptoms that are described by recovering participants that constitute long COVID. The primary among them is fatigue, so just profound fatigue that doesn't get better after a month of illness. The other symptoms are loss or change in taste and smell, memory loss or cognitive dysfunction, which is commonly described as memory fog. So you're not usually like that. You have difficulty remembering things. You have difficulty performing your day-to-day activities because you just don't have a clear mind. Any psychiatric disturbance, anxiety, depression that is new or that has worsened because of COVID. Other symptoms, respiratory complaints, so cough, cold, congestion, shortness of breath that doesn't get better, palpitations, chest pain. So long COVID symptoms can look different for different people. So each constellation, so the group of collective symptoms may be unique to each individual, and it's not one size fits all. And that is usually reflected in therapies as well. So with that, I think I'm going to transfer you back to the Reverend.
No, thank you, Dr. Roth. I think it's important as you discuss these symptoms. One, so that we acknowledge what has happened. There's so many people who've had COVID. Those who I pray know that they've had COVID, and those who may not even know but have felt symptoms because of their interactions. One of the things that we did on last year, because it was important for us, is to inform our community. We wanted people to know what was happening and to address a lot of the misinformation that was in response to the vaccine. We had Dr. Chidi Akasobi come in, and we had just a one-on-one conversation, and we took live questions just like we're doing today, because one of the things that we're worried about is how does this affect our community? What we do know is that there was a disproportionate effect for varying reasons that happened to our community and those whom we serve each and every day. And so Dr. Cassandra Pierre is here to kind of help us think through what does this actually mean for our community. Many of them are watching right now on Facebook, YouTube, and Instagram, but help us kind of think through what does this mean for us? How are we to think about this? What are the impacts that we may not even know that are happening that you all are tracking, and how are we to actually prepare ourselves for what is to come?
Thank you again for having us. I am thrilled and really excited to be here to have this conversation and answer this question. My name is Cassandra Pierre. I'm an infectious disease physician as well, and I am also the medical director of public health programs and the associate hospital epidemiologist at Boston Medical Center. So as you've just said, our community, Black people, Latinx people, people who are indigenous, have been disproportionately affected at almost every step of COVID-19, infections, hospitalizations, and death. And so with all that, you would think that we would also, unfortunately, be disproportionately at risk for long COVID. But the numbers aren't there because we don't really have a good sense of what the numbers are. There's no reliable data. The one study that we've seen so far that has a connection between race and long COVID shows that in a study looking at Long Beach, California, there was a higher risk of long COVID and more severe long COVID among Black people. So race was a risk factor in that study for long COVID, but we still are definitely needing more information. And anecdotally, if you look around the country at long COVID centers, they are not serving people of color traditionally. We don't see that. It's not people of color who are in those clinics. And so we have a lot more to learn. But it's also likely that the same factors that put us at risk, our structurally marginalized communities at risk for COVID, are also the ones that might be serving as barriers, as blinders for looking at long COVID. So some of the things that we've talked about, lack of education and health education going out to our communities, letting them know, if you still feel bad after COVID, it's not just you, it's not just another side effect of living the way we do. It is possible that this is long COVID. So getting that information out to people. Also, many of us work in frontline jobs. We do not have the luxury or the time to take time off from work. Taking time off from work for some people means not getting a paycheck, or maybe even worse, depending on their employer. And so we don't have time to take care of our health, we don't have time to do preventive health, and we don't have time to get care for those symptoms that might be long COVID. And even if we have health insurance, again, many of us live in structurally vulnerable communities where by history and design, we don't have access to high quality health care. And so we may not have the ability to just go into a center and get care, or we sometimes also face the additional burden of having to convince our provider that yes, we have something going on, yes, it's real, and yes, it should be taken seriously. So those are some of the reasons why we may not be seeing a signal yet for long COVID, but we need to look into it because we know, just like when we looked into COVID, we saw who was suffering. So we need to shine some more light on this.
No, thank you. Thank you for that, Dr. Pierre. As I think about what you're suggesting, it speaks towards not only the systemic fractures that were already present, but how they were exacerbated. And we're combating this interesting moment, and I think about the people who are living with this, and how do they live? How are we living with long COVID. I want to make sure I get the other doctors involved in this conversation because we've already gotten so much. We have Dr. Catherine Gergen-Barnett, who is here with us. Doc, could you speak to us just from your lens about long COVID and help us understand more about how people are living with this and what are we to do?
Absolutely. So I also want to echo my thanks for being here, for your beautiful introduction, for the way that you've held this community through so much suffering, and also moments of joy. So really, first of all, I'm Dr. Gergen-Barnett, and unlike my wonderful colleagues here who are all infectious disease doctors, I do a kind of medicine called family medicine, where I take care of the whole person and the whole family, and really think about them in the context of community. So I've really been through the course of the pandemic and my career thinking a lot about how does an illness that's affecting one person impact the entire family and the entire community. And that's particularly true for lots of pieces of the pandemic, but I really wanted to focus today on some of the mental health consequences of what's happening for long COVID. We know that there is so much stigma around mental health, period, in our communities. But long COVID has added this layer of complexity where not only are we having some of the physiological changes or the biological changes that happen that we already heard can affect all different parts of your body, but they also affect, as we heard, the way you're thinking, the way you're feeling. We don't have all the answers about why that is, and we'll talk a little bit more about that. I'm sure there are questions about that. But we do know that the virus passes through what we call the blood-brain barrier. So it can actually impact the way your brain is working, and therefore can also impact your moods. Partly, part of it is spiritual and psychological, but part of it is also neurological. So there's some of those impacts, but we also know that there are lots of studies that up to 50% of people who have recovered from COVID-19 are suffering from increased rates of depression and anxiety, and those rates are even higher for people who have been in the intensive care unit. In a way, that's not surprising, but that's really significant when you think about the impact on people's lives. So how can we actually recognize this? First of all, how do we start talking about it? This is a great place to start, having conversations like this, recognizing that long COVID is there and it impacts your mental health, but also turning to one another. If you are seeing somebody who you love who's had COVID-19, who seems more anxious, who seems more depressed, how do you make sure that you're connecting to them? And then if you are taking care of somebody with long COVID or you're a loved one, we know how much stress it is to be a caregiver. For somebody who has symptoms, who may be completely dominating their life, I take care of people who used to be incredibly productive, successful, energetic people, breadwinners of their family, and can't do any of that anymore. So family members are suffering in all kinds of ways. So as a caregiver and as a loved one, how do you take care of yourself? So first of all, just don't watch COVID-19 news all of the time. I think that's a good recommendation for all of us. I know I try to follow some of my own advice, but that one is a little bit hard to do sometimes, right? So take a break. Make sure you're taking care of your own health. So, there's a saying, and I know it's really hard to do, but how do you put your own oxygen mask on first before you help somebody else? So taking care of your body, your spirit, making sure you get exercise and sleep, and you have access to healthy foods. If you don't talk to people in your community, especially at Boston Medical Center, we can help people get that kind of care. And we also have lots of behavioral health that we can help you access. And then finally, I would just say that how do you make sure that you're not actually increasing your own stigma, that you're not feeling loneliness on top of the impact of mental health, depression, anxiety. So if nobody is asking you how you're doing, making sure that you offer that when you see your physician, whoever it may be, or some sort of provider you take care of or takes care of you, and then it's our job also, in medical care, to educate ourselves and ask the questions. So we are working on that as well. On all levels, we've all got to be working together to take care of each other. So thank you.
Thank you, Dr. Barnett. This was so important as you were talking about mental health. We're blessed at TBC because the First Lady of this congregation is a psychiatrist attending over at BMC. And so we have these conversations around wellness and what does this mean in this moment. But I think it's important that we're thinking about this from a long-term vantage point, because it does have an effect not only on yourself, but on those who you love. And I think what we're really trying to really push at here in this congregation is healing. Like cura personalis, healing the whole person, not just the health, but literally the mental and spiritual health of the person. So I thank you for lifting that up, because it's something we try to highlight in this congregation always. I want to get, not last but not least, Doc, I know you have so much to give us as we're thinking about this moment. We also think about treatments. We're also thinking about support. We're also thinking about all that is happening. I want to bring Dr. Benjamin Linus into this conversation to help us process. You've had three great sisters bring so much. I hate to put you at the end to anchor us, but please help us think through this.
My name is Ben Linus. I'm also a doctor at Boston Medical Center. I take care of people who are living with HIV and also living with substance use disorders. And also, I'm the director of a program that's called Massachusetts Community Engaged Alliance to combat COVID-19 disparity, or we call that MassSEAL, which is a initiative from the NIH to get out there and start trying to do something about these horrendous disparities that we've been seeing throughout the pandemic from the very beginning. I think I have the easiest job tonight, which is I'm talking a little bit about the vaccine and what it means for long COVID. So the first thing I have to say, being an infectious disease doctor, if we're talking about the vaccine in 2022, I have to take that opportunity to talk about how effective the vaccine is and to encourage everybody to please to consider and to get vaccinated. I think there's a lot going on, a lot of information out there right now. You may have heard people saying, oh, it doesn't work anymore anyway, it's not good for Omicron, so why should I bother? And I just have to take this opportunity to remind everyone that if you hear that, it's a partial truth, which is the most dangerous kind of truth, right? There's a little bit of truth in it, but it's not the entire situation. So it is true that the vaccines that we have today are not as effective at stopping Omicron infection as they were at stopping the previous viruses. And everyone, I think, has seen that it's possible to get an Omicron infection even when you're vaccinated. However, the thing that is clearly true is that even with Omicron, these vaccines reduce your chance of getting sick and going to the hospital or dying by a lot, approximately 90%, and that has not changed. And at the end of the day, that's really what we say when we say a vaccine works, right? That it's going to keep you alive, it's going to keep your family healthy, it's going to keep you healthy. And right at the bottom line, that's what I think all of us care about. So when you hear that it doesn't work, it gets confusing at times, but that's really not true, right? If you get vaccinated, you can feel confident that even if you do contract COVID-19, your experience is going to be a lot different than if you had not been vaccinated. And we see that in the hospital now. It feels very different. When people have COVID, it's a different experience when they're vaccinated than it was 2 years ago when they weren't. Regarding the vaccine and long COVID, actually there was some studies that are just starting to emerge. I don't think I can give an easy answer now, because I think we've all learned throughout this pandemic together that science actually is not immediate, and that some of the things that we take for granted as being understood, like gravity or things like that we've known about for hundreds of years, actually it took a while to figure that out, right? In hindsight, we just take it as a fact, but while people were discovering those things, it wasn't fact, it was still being discovered. And that's where we are with long COVID and the vaccine. But the data that are starting to come out now from early studies is that actually getting the vaccine reduces your chances of getting long COVID by about half. So if you get a COVID infection and you were vaccinated, right? You're 90% less likely to get sick and go to the hospital, and you're about half as likely to develop long-term symptoms. So really, there's even more evidence now coming out that the vaccine can keep you out of the hospital, it can keep you alive, and it can make sure that your COVID infection only lasts a little while and then it goes away. So really, with all of that sort of piling up behind it, it's just really compelling case that I really want everyone to consider going out to get vaccinated, because I really do think that's a major part of what's going to help us emerge from this nightmare. And if we all do our part to get vaccinated, I think there's a path out at this point. So there's good news on the horizon. We're hopeful that if people are vaccinated, maybe we won't see as much long COVID. And stay tuned, because that data is still coming, right? And we're still going to learn more, and I'm sure there's more to that story that we'll learn about together in the coming 6 months or a year.
Thank you, Dr. Linus, and I appreciate the work that you all are doing as we're dealing with this. One of the things that I believe is important is talking to the people, hearing the voices of the people, and allowing that to inform not only how we understand issues, but inform the work that we do. And we want to have questions and answers. We can't have your great minds here and not have the people be able to speak to you directly. There is one question that's already come in, and it is concerning children and long COVID. And I know you all are here and can speak to this. The question is, what studies have been done? I know we talked a little bit that studies are still actively happening, but how do we think about the effects of long COVID on children? What are the symptoms? What should we be expecting, as well as adults? Well, we've talked about that a little bit, but really, particularly around children, pertaining to them, how do we think about that? I think about, some of the young people who have had COVID-19 in this congregation, in this community. What are we to be thinking? How do we help parents think through this moment as they're projecting their children's future?
Actually, that's a really great question. Children, in general, are less likely than adults to have long COVID. However, children, especially children who come from BIPOC communities, so Black, Indigenous, people of color, are more likely to have a condition which is because of inflammation 4 or 5 weeks after the initial infection with COVID-19. It's an inflammatory response and often puts the children in the hospitals, requiring intensive care level workup, round-the-clock medical care, and the recovery is slow. This can be decreased, like even if children are not of an age when they can receive the vaccine, so age less than 5, they can still be protected if family members are vaccinated. So again, to Dr. Linus's point, vaccination plays an important role. When it comes to the long COVID symptoms and not the inflammatory response, you might notice the children behaving differently. So lack of attention in school, not getting the same grades they probably were before, depression, loneliness, fatigue, not being able to keep up with their peers are some of the symptoms that have been described in children. Again, I said that it's less likely that children will develop long COVID, but that incidence is not zero. So if you notice that your child is not the same as they were before the diagnosis of COVID-19, please do go to your pediatrician so that they can get the appropriate help they need. It is so very important to recognize it early so that we can provide help.
I'm just going to add a little bit. Thank you for that. In Boston, less than a third of children 5 to 11 are vaccinated, and this is a big gap. And so I think that, as my colleague Dr. Linus was talking about, we are all facing a lot of information that comes to us at very different times. I think the information that came out, especially in the early days of the pandemic, that this cannot affect children, has done us a disservice in the long run. We know that children absolutely can get COVID. We know that children, especially children in communities that we take care of at BMC, are more likely to get long COVID. And so just reminding folks that these vaccines are readily available. And if you still have questions, obviously we can field questions here, but really making sure you talk to your primary care doctor about it, who can answer all of your questions as well, and really talk through all of the incredible data on the safety and the efficacy of these vaccines for our youngest people, 5 to 11, in our communities.
Thank you so much. It's been such a controversial topic. We're just going to be honest about it. We at 12th Baptist Church have been very supportive of vaccines, which is why we did the work and partnered with BMC. But we recognize it's been such a controversial topic, and our goal is to get ahead of the misinformation, to get ahead of the potential outcome that could, will still affect us either way. And so it's important, and I thank Donna Voss, who's a member of this church, for asking that question, because there are parents who are worried. I have a 2.5-year-old son. That is a worry that we all have of what does the future and the trajectory of our children look like after this moment where they've dealt with so much, whether it's school, whether it's just playing again. The normal will never be the normal again. And so that's a very helpful thing for us to do. And we'll continue to encourage families to make sure they get those vaccines, to encourage getting the testing and make sure you know your status as well. There's another question that came in from Brother Paul Dozier, and he asked a question I thought was very interesting. He says, what are the effects and symptoms on memory with long COVID? I think about this also just from a position of ways in which Alzheimer's affects our community. Dementia, early onset dementia affects our community. How do we think about long COVID in that context?
That's a great question. So long COVID, as you've already heard, can have significant neurological side effects. So it definitely can affect cause dysfunction in the brain. What we see more commonly, people call this a brain fog or a memory fog in the very beginning. Really difficulty concentrating, sometimes even remembering words. Remembering tasks, being able to complete your job. And so this can have a really significant effect. It's more than just a brain fog. It's actually a problem with thinking at a very fundamental level. And for some people, it gets better sooner than it does for others. Just like the rest of the symptoms that happen with long COVID, every person is different. And we see different types of manifestations or different types of presentations of long COVID, even if it's a brain issue. And we don't know how long it might last for any given individual. We're still trying to learn and figure that out. But again, this can be as simple as having word finding difficulties or just feeling like you're in a haze, to not really being able to remember tasks and having difficulty with your short-term memory, and maybe even more profound memory loss. And I also just want to mention that this is not necessarily age dependent. I know that we've talked about, just mentioned, as we age, we might see Alzheimer's more profoundly at an earlier age in communities of color. What we're seeing with long COVID is that it affects not just older people, but we're actually seeing more of a tendency to affect younger people as well. People in the prime of their lives who have to work, or have to, or maybe even doing some schooling later in life. It really does strike people down in the prime of their lives as well. So we see that kind of effect on the brain, even in younger people.
So I'm thinking about the asymptomatic person, if you will. They had COVID, showed no symptoms. Didn't present any signs that there were anything that would affect them. How should they be thinking about long COVID? Are there effects that may show up later? What are we to think? I have some peers who think they're invincible, and I got through it. I got everything, but I'm good now. But how do we think through that? That if I didn't show any signs, if I did have COVID, vaccinated or not, right? Will there be anything that we should be looking at in the long term?
Sure, I think that's a great question and a hard one to answer because I don't think we really know yet, honestly. I think we do know that if you have a more severe form of COVID, you're more likely to develop long COVID symptoms. And so in that sense, as your symptoms come down, you are less likely to have long COVID. But we don't really fully know all of the longer term consequences of developing even an asymptomatic case of COVID. So I think we have to be honest about that. I also think we should be clear. I don't want to put a panic out there that there might be sort of a time bomb ticking in you that we don't know about. I don't think that's worth that people should develop anxiety about that they had asymptomatic COVID and maybe it's going to show up 10 years from now. But also, we can't really now say what's going to happen 10 years from now because we haven't had the 10 years of experience to know. So I think that's part of one of, honestly, the most anxiety-provoking things about all of this is that there's a certain amount of uncertainty that is just inherent to the situation that we're in. But I think we should just acknowledge that that's true. We have to make the best decisions that we can now, knowing that what we know now. And so I think the best decision is to do your very best to avoid getting COVID, get vaccinated, wear your mask in public while we still have masking mandates. And that's all you can do. And if you have asymptomatic COVID, I think you should be grateful that you had asymptomatic COVID and move on. And we're going to learn more together over the coming years. But I want to be reassuring, but also I don't think we can sit here and say that we know as a medical fact that what's going to happen 5 years from now, because honestly, we don't.
So Dr. Linus is actually absolutely right. We don't understand everything about long COVID. So we are learning as our patients are learning. And what I want to stress is that long COVID, the term itself was coined by a patient. The diagnosis and the symptoms were reported by patients, and so many people reported the symptoms that the medical community started taking notice. And that is when we started learning. So it's a partnership between our patients and ourselves. So if you're asymptomatic, you never had symptoms when you got the diagnosis of COVID-19. But during recovery phase, like a week, 10 days after your diagnosis, you suddenly start experiencing new symptoms. Please let us know, because we do want to know about that. It may be a new long COVID diagnosis, but we wouldn't know unless you brought it to our notice so that you can be evaluated and we can extend you a helping hand. And in the same breath, I will say that to help us understand this better, there are research opportunities. So if you're interested in learning more about the evolution of COVID, there are long COVID studies that we are doing at Boston Medical Center, which we would be happy to recruit anybody who's interested so that we can learn about the disease process together. And the contribution from our patients is really, really critical because it informs future generations. It informs communities around us. It helps our own patients because now we can be better doctors. We can recognize things earlier and help you earlier. So just being asymptomatic may not mean that you don't develop long COVID, but like Dr. Linus said, if you had severe disease in the beginning, you're more likely than asymptomatic person to develop long COVID.
Thank you. What if you didn't know if you had COVID? Like, you know, early on, a lot of people like, I felt something, you know, by the time I made it through it, you know, felt something like maybe pneumonia or bad flu or cold. How are those persons who were never, you know, diagnosed per se, to approach this? You know, what are some of the things that they should be thinking about? Should they take the same approach as if they had COVID?
Yeah, that is a great question, especially because we actually have data from the beginning of the pandemic that showed that people of color were less likely to be tested for the same symptoms that others were. And so now we have more availability, obviously. But back in the beginning, you know, many people did not have access to testing and kind of were self-diagnosing themselves or wondering about what was happening and may still continue to have symptoms today. So what I would say to a lot of people is it's time to get primary care. It's time to find a trusted medical provider. It doesn't need to be with Boston Medical Center. I really want people to go where they feel comfortable, where they feel like people are hearing them. I tell people all the time, sometimes like finding the doctor that gets you or the mental health therapist that gets you is like finding the right relationship. And you shouldn't stop until you feel heard and that you feel like this is a comfortable space for you. So I'm not just saying flippantly find a doctor. I know it can be a process for many of us who've had not just historical experiences in our community with mistreatment, but experiences within our lifetime. However, there are people out there for you who are going to work for you to figure out what is happening. As far as figuring out whether or not you had COVID-19, we can do some tests for people to see whether or not they were exposed to it. Those tests are not always 100% accurate, and so we do have to go, we try and look at symptoms, we try to figure things out, but the most important thing really is supporting people through the symptoms that they're having at that moment and trying to figure out what we can do to make that better and treat it.
Well, I can't not speak up after you giving the shout out to primary care, so thank you. But the thing that I would just add, and I know that we're going to hear more about our long COVID clinic at Boston Medical Center in some of our remaining minutes, but really also thinking about just this is how do you, if you're having symptoms and even if it doesn't fit any kind of long COVID laundry list that we gave you, how do you make sure that you take that step for exactly what Dr. Pierre is saying is developing a trusted relationship so that you can not only get care for those symptoms, but that you can actually walk forward on the path to, what hopefully will be many, many years of a full and vibrant life, but that you have a partner and you're not asking these questions by yourself.
So since Dr. Jurgen Barnett gave a plug for the long COVID clinic, I think the clinic at Boston Medical Center is called Recover Clinic, and it's a multidisciplinary clinic, and we established it expressly for the purpose of diagnosing and helping people with long COVID. So some of the questions that have come up are very, very relevant, and they're kind of difficult to answer as an individual medical provider. But as a team, sharing our collective brain power and looking at our patients in a more comprehensive way might allow us to be better physicians and be better able to take care of our patients as a whole, not just piecemeal, right? Like, you don't go to a cardiologist and say, I have palpitations. The cardiologist then says, oh yeah, but I can't help you even though you have a swollen knee. We don't want that. We want to be a team that is taking care of a whole patient. And long COVID has forced us to look at it through a more comprehensive lens and see how we can make that process better. So at Boston Medical Center, the way we have structured it is that you have an intake interview where we tease out whether some of the symptoms you are describing, even if you never were diagnosed with COVID, might be long COVID, and how we can help clinch that diagnosis. Once we do that process, then the remainder, we have partnership with cardiology, lung doctors, therapists, so both mental health therapists, psychiatrists. We also have partnership with the rehab people, so physical therapy, occupational therapy, respiratory therapy, and surprisingly, speech therapy, because you won't believe how many people actually require speech therapy after a prolonged illness. So people who ended up in the hospital, maybe they were on a breathing machine. During their recovery phase, they need all of these supports in place, not just the specialists that are looking at them. We have rheumatologists who look at bone and joints. We have ENT physicians who look at ear, nose, and throat to make sure that symptoms are comprehensively addressed. And then we have neurologists specifically to evaluate all the memory loss issues, any neurological problems, right from weakness to fatigue to what have you. Like, I'm sure my patient wouldn't mind me sharing her story, but during recovery from COVID, my own patient in my clinic started complaining of scalp tingling and hair pain. Like she said, it feels like when you sleep on your hair and it is standing up and never can lie flat. That's how painful it is. We did all kinds of tests, And finally, the neurologist ended up offering an MRI because nothing we did actually showed us any conclusive data. And what we found was surprising. She actually has a little small tumor that is impinging on those nerve endings that are supplying the scalp, which is weird. So she came to us for long COVID, but because of a comprehensive evaluation, we were able to diagnose a tumor in an early stage. So again, I don't want the takeaway message to be that people with long COVID don't have long COVID, they have something else, but it's that the clinic serves multiple purposes. It helps you figure out whether your symptoms are long COVID, and if they are not, could it be something else? And so it's important for you to have that relationship. And wherever it may be, like at BMC, we are always happy to see you, always happy to help. But if you have a therapeutic relationship, a trusted relationship with a different academic center, that's okay too. Wherever you seek care, all we want is for you to get the care that you deserve and for you to feel well. So with that, anyone else?
Well, thank you. I think it's helpful to know where our community can turn to and know that you all have a clinic that is set up that is focused on this. I'm thinking of another question that has come to us, has been about, what can you do in the everyday? I can't come to the clinic every day. So are there practices, are there anything that you can implement in your daily practice in life that can combat long COVID? I'm not sure, but this is a question that did arise. Are there any supplements, anything that you would suggest beyond getting the vaccine, which you should get, but anything that you can do in the daily that could combat some of these symptoms that you've discussed on today?
I'll start because you mentioned preventing and then also treating. So prevention, there's been a lot of conversation about what supplements, what can you do to prevent COVID. A lot of that hasn't been fully, there's talks about different types of vitamins and different things that you could take. Not all of that has panned out. That said, the best thing that you can do to prevent yourself from getting long COVID is probably the same thing to do to prevent yourself from getting COVID. In addition to getting your vaccines, taking care of your health, treating or preventing chronic diseases like diabetes, high blood pressure, eating good food, which carries nutrition with it. Those are all, I know they seem silly to say, that you go to the doctor and you're hearing the same thing, but taking care of your health is really a critical step to, preventing some of the more severe outcomes that you might see with COVID, and generally a good way to keep yourself healthy in the long run. As far as treatment is concerned, we've just heard that every case of long COVID is different. The manifestation, the symptoms are different. And so, by default, we have had to learn with our long COVID clinics to do a tailored approach to therapy for each patient. It's something that really every patient deserves to begin with, but there really is no cookie cutter response for that about what you can do within the clinic for treatment or what you can do at home for treatment. So I would say it really depends on your symptoms, and that's why it's important to have that good therapeutic alliance. Dr. Murthy, anything else?
So I know we already talked about vaccines and it's a sensitive topic, but actually what we know is that people with long COVID who are unvaccinated, if they choose to get vaccinated now, the severity of the symptoms goes down, and some people even experience complete recovery from their symptoms. So I think that is the best tool in our arsenal for now. Other things that in our clinic at BMC have worked is different rehab therapies to help people regain some of the stamina that they may have lost during their prolonged recovery from COVID. So being able to do just physical therapy and occupational therapy, so those exercises to get your stamina back up. And then nutritional support, like Dr. Pierre already mentioned. We, in our community, what we have recognized is we all live in New England. Our skin barely sees the sun all of us have a vitamin D deficiency, almost always. I shouldn't say it's everyone, but most of our patients we have recognized have vitamin D deficiency. And so we are supplementing that. And for whatever reason, that seems to actually improve some of like the leg pains or tingling that patients have been describing. We haven't found a lot of like other supplements that patients have been taking over the counter that seem to have made a difference. But again, our clinic started 6 months ago. And so what will happen in the next 1 year, or whether that will make a difference if it's taken on at a longer period of time, I just don't know right now.
No, thank you for that. Those responses, I think that's very helpful. Dr. Pierre, you mentioned food. I like good food. I actually like to cook a lot. TBC knows that about me. I do have a question because one of the symptoms is the loss of taste. And one of the questions that's come to us is, with long COVID, will there be a restoration of my taste or sense of smell? What is the answer to those folks who are concerned about those symptoms that they experienced?
Sure, no, I understand. I think we can be reassuring that most people do regain their taste or sense of smell over some period of time, but as people have discussed on stage tonight, it really depends on your case. Some people regain their taste of smell, their sense of smell or taste quite quickly during the sort of 1 or 2 weeks that they have their acute COVID symptoms, and other people report losing them for weeks or months. And we really don't understand yet who gets which path of disease and why. So I think if you're a person who right now is experiencing a loss of smell or taste, we want to be reassuring that we expect you to get that back. But at the same time, we can't tell you exactly when. And if that's happening to you, and if it's been lasting for more than 3 or 4 weeks, please come seek care. Come talk to Dr. Marate. It's really an honor to work at BMC, and a real honor to work with Dr. Marate, because not every hospital has a long COVID program. And actually, if you look around, not surprisingly, you can probably guess which hospitals do have them and which ones do not. And it reflects a lot of the same disparities that we've seen in US healthcare forever, for decades, and certainly throughout this pandemic. And it's really a huge honor to be working at a place that sees this, and that we recognize that this is, the next front of disparity in COVID, is that long COVID care is not equally distributed around our country. And we really want to be doing something about that, at least in our own community. And so Dr. Marate, BMC are making real commitment to make that happen. And it's just, I want to say that it's really a privilege and honor to work here and to work with you guys, and to feel like I'm a part of that kind of an organization, and to encourage everybody to take advantage of that. And please come seek care if you're having those symptoms.
Thank you very much. So we have a question from the audience that we're going to have right now, so I'll hand it over to you, our audience member, to just introduce himself and then present his question. You can pull the mic up.
Hi, my name is Kenny Mack. I'm with the Brothers with a Vision of Massachusetts. It's a nonprofit organization in the community. We've done some work with the Boston Medical Center with Patrina, and I just wanted to come out and support, and I hear a lot of things that you guys are doing. I had COVID like in November last year, and the way that we got it is we did what we shouldn't have did, and I knew we shouldn't have done it. We got together for Thanksgiving, all the family members, because there was a false sense of security, and one got it, then the next one. And my wife, she had it more serious than everybody. She couldn't get rid of her temperature. It was like way up there, and that was the most concerning part. And she's like the caretaker of the whole family, but when she went down, it was a whole lot more different things. And sometimes I find that even a year out, I've had all my vaccines. I get tested once a week, but sometimes my breathing, I get winded a little bit, more now than before, and it can happen at different times. The one thing good that happened in the beginning when COVID, I lost like 15 pounds, right? So I know I gotten better because it's the appetite's back there, but it kind of comes and it kind of goes, and I was just wondering, like, do we really even know like what the long-term effects are, or are we kind of just moving in the dark?
Well, first of all, thank you for being here, and thank you for your question. Thank you for your support. The first thing I just want to address in your question, which was that little bit of a sense of self-blame, which I wanted to make sure that you are hearing and that everybody who is listening is hearing, which is really we need to take the self-blame out of this, right? There's enough kind of hatred in our world that's the last thing we need in all of this, and sometimes people are doing all the quote-unquote right things and still get COVID-19. So just kind of starting from that place of recognizing that there's a lot we're learning all the time, and that the desire for a full life is also very real. So I just wanted to kind of then address your shortness of breath, and you know, we were sort of in our long list of symptoms that is absolutely one of the possibilities is having some of that shortness of breath. You talked about some weight loss, but happily have had your appetite come back again, and that's wonderful. And so what the bigger question that I heard you saying is, how do we know how long these things are going to last? And that's, I think, Dr. Linus was saying, and so many of us are really kind of sitting with this, which we're in the middle of the story right now. We don't know how the story is going to end. The good news is we're learning more every day, and the good news is that we now have these comprehensive clinics that take care of so many of the different symptoms, so that we can really care for the individuals with different kinds of symptoms. But again, the more that you share and the more that the community shares and the more that individuals share about what they're experiencing with their providers, the better providers are going to be in taking care of communities. So really grateful you shared that, and also please make sure that, if anybody is experiencing that they share it, they don't feel alone, that they're not blaming themselves, and that we very much hope that these things are transient, but we just don't know.
Thank you for that question, and we'll continue to pray for you and your wife and your family as we're trying to do this work collectively. I want to ask this question from the Spirit, from which we just heard. What more can we do? I just believe we all do our small parts, and if we do it collectively, we'll move things together. What more can we do? What are the things that, if you had the desire to tell somebody something, what would you tell them? What more could we do? We know we want to continue to encourage vaccination, continue to get boosters, continue to vaccinate our underage children, our young children who are able to be vaccinated. But what more can we do in our small pockets and of our lives, and how do we go about doing that? Yeah.
I would say expect more. Expect to go to see your primary care doctor and be listened to get the help and the referrals that you need. If you are experiencing symptoms, demand care for them, and if you are told they are not real or you're waved away, then you know that's not the right place for you. The other thing I would say is share your experiencing, like we just heard, and I thank you so much for sharing that. I think there are so many of us who are probably experiencing symptoms, lingering symptoms, and we may say, well, this is just a long recovery. There's actually a word for this. It's long COVID, and there is help for it as well. So I think expect more and share your stories. I think the more we hear about it, the more people will recognize themselves in the like, oh, this is me. I'm having that too. And there's over 55 symptoms that have been connected with COVID, and probably many more. So like I said, everyone's story is individual, so the more we're able to share this, the better it will be.
I want to build on that too. I think that there are many moments of darkness that we've all been through, but there are potential bits of light. And I would say that potentially this is an opportunity to revolutionize the way that people get care and that the way that they insist on good care, and also really an opportunity to address the centuries of medical distrust that we've had in communities. We are actively, I'm working with several different community organizations right now. We're actively collecting stories. I'll give you the link. I would really invite people to share their stories about moments where there has been medical distrust or moments of trust. We are working on actually creating curriculum for healthcare providers as they come up based on people's stories. So your wisdom will light the way for the future. So very much along the lines of use your voice, please contribute. We are here to listen.
To that, I think that if you are experiencing long COVID symptoms, to please come and seek care, as we've been saying. And I would encourage people to consider participating in the research study that we're doing about long COVID. It's called the RECOVER study. It's a very large study across the entire country that's being run by the National Institutes of Health. The goal of the study is to learn more about long COVID. I think there's a clear history of medical apartheid and mistrust that Dr. Gergen-Barnett is referring to, and we all at BMC are all very much aware of that and trying to work on that topic and to address that and to build trust. But I've had the experience during the pandemic of talking to folks who want to know about the vaccine or want to know about a COVID therapy and ask, were people like me in those research trials that you keep citing? And you keep telling me that we have the data, but were folks like me in those trials? And very often now I can't really look somebody in the eye and tell them that they were. Right, because too often our studies are almost entirely Caucasian people, and we are routinely leaving out people of color, communities of color from these research projects. And if we want to have the knowledge about what long COVID looks like in BIPOC communities, we need to have BIPOC people enroll in these studies so that we can learn. And I can say that I'm not going to say that we're going to be perfect, because we won't, but I can say without doubt at BMC that we very much want your trust and we very much want to act in a trustworthy way. And that also the RECOVER study, for example, is not an experiment. No one is going to be giving you a therapy. You might be asked to donate some blood samples or a saliva sample or something like that, but it's what we call an observational study. And one thing that folks can do to give back to their community is to participate in research like that, because there's no way to learn about it unless we have people participate. So think about that, and I think we would be very eager to hear your stories of mistrust, as Dr. Gergen-Barnett was saying, and we're very eager to learn more about how we can act in a trustworthy way so that we can earn your trust. But to think about research, and I hope we can build those bridges in the coming weeks and months, because I do think it's going to be very important to learning the answers to all the questions that were asked tonight.
Thank you. I have one last question, and I'm going to give closing words. Have each of you give your last statement to the community and to the folks whom we've had time with tonight. This question is interesting, and I think is very, very, very appropriate for this setting. One of the things that we encourage in our faith tradition is to bear one another's burdens and sorrows, but to also share in each other's joys and celebrations. And Dr. Gergen-Barnett, it came to you. Could you speak about the benefits of the value of faith communities? Could you speak about spirituality and just how that helps in combating COVID-19 and others? If you would like to add to this conversation, I think it's important. What does community mean, particularly for us faith communities, and how they've allowed for us to help combat this moment?
I'm so grateful for the question. Well, first of all, let's just start with this idea of community. So we know that loneliness is actually as dangerous to your health as smoking 10 cigarettes a day. We know that it causes all kinds of long-term health issues. So being in a place like the 12th Baptist Church, having such a strong community, that in and of itself is going to improve your health. The faith piece, there are so many studies, but we don't need studies because we can feel it. When people have a strong faith or connected to a faith community or strong religious belief, it's protective for health in all kinds of ways. But part of it is because the stress response, the way that our body feels stress, which we know has a cascade of hormones that can negatively impact our health, that stress response goes down when we're feeling connected to something we love, something that brings us joy. So for every single person, that could be a different thing. But finally, the thing that I wanted to address is, how do we love your neighbor, right? And this idea that I said really around mental health, how do you actually look to see how other people are doing, to lift their burden, to ask them the question, to just drop off food when they seem like they're suffering. Maybe not even have to ask them the questions, but just to be there shoulder to shoulder with them, to walk the path. All of those things are just invaluable in daily life and have never been more valuable now.
Well, we appreciate that, and we are working to love our neighbor. We are a church of love, light, life, and liberation, and our mission is to liberate all of God's people through the love of Jesus Christ. With that, let's have parting words, last statements that you would like to just leave with the people as we close out this great panel and this great night, and then I will close us out as we transition on this night and encourage the people with information. Dr. Maratha, I'm going to ask you to cue us up on that information. How do we find out what to do? Who do we turn to? How do we contact all the folks at the clinic and everything? But I just want to give each of you an opportunity to just give some closing words.
I am, first of all, really grateful to be here to talk, to really have this conversation, and I really hope it's the beginning of more conversations, honestly, not just about long COVID, but so many other things. One thing, we've talked about, not here, but just in general in the healthcare field, is that when we look at long COVID, it is very similar to other types of chronic diseases like chronic fatigue syndrome. But I think we're actually learning as we learn about long COVID, yes, from our patients, but also from our mistakes. So many times we've had diseases that were similar to this, chronic fatigue syndrome, fibromyalgia, other things that were difficult for us to really pinpoint. What are these symptoms? Why are they caused? And I think it was easy for us to say, this person, it's all in their head, they have anxiety, and this is why they're coming in with these symptoms. I think and I hope that this will actually teach us that our patients know that they're best historians, to trust what they're saying, and give them the care that they need. Just like COVID is showing us where the disparities in healthcare have been, I think long COVID is teaching us a little bit about our own blinders when it comes to dealing with and treating our patients and taking them at their word. They have taught us that this exists, it's real, we need to reckon with it because it's going to be with us for a while, just like COVID. And I'm hoping that in the spirit of humility, we can start to atone for some of the earned mistrust that our patients, this community has experienced. And I hope that people will be willing to come back and find a provider that they trust with their care and their story.
So if you are suffering from long COVID, please do seek care. If we can help you at Boston Medical Center, we'll leave the contact information so that it can be disseminated to everybody. We can share it on Facebook. We've given our email addresses. So if anybody wants to contact us, please do feel free. If you take away one thing from this conversation, is that long COVID is not a death sentence. It also may not last lifelong. We have several people who have recovered from their symptoms 100% and are living happy, healthy, back to normal lives. Initial journey for them might have been hard, but they have overcome it. And the goal is for each individual to be walked through that journey with support and care to get you through to the other end. So again, if you're experiencing something, don't be shy about sharing it. And if we can help you, then all you have to do is ask us, and we'll do the best we can to support you in your journey.
Very briefly, I would say that if you don't have a primary care physician, please make sure you have one. We are here to be on the journey with you. Nobody has to suffer alone.
You think I could prepare for this? We saw it coming, right? First, I just want to say thank you and let everyone know who's watching how humbling it is to come here and have a community say, we think that you have some expertise that's valuable to us and we want to ask you questions. I really appreciate that, and I'm happy to be here, and I hope this has been helpful. And I guess my last words would just be to everyone to step back, and if you're listening and you're here now, to take a breath and congratulate yourself. You're here. You've been through 2 really crazy years, and we're not done yet. I think there's probably still turbulence to come. We're talking about long COVID, and we're right in the middle of another round of mask debates and all of those things. But I do think it's important to step back and recognize that there are moments of joy in this pandemic, and to try to find those times that I think many of us have experienced where, although it was one of those crazy pandemic moments, it created some sort of opportunity that wouldn't actually have existed if it hadn't been for the pandemic. And try to encourage people to really lean into those moments and focus on them, and to give yourself the credit for having made it this far, because it's not been an easy trip for any of us. So congratulations on that, and hang in there, because I think there's light at the end of the tunnel. I hope that there is. None of us can predict exactly what's coming, but I'm hopeful for the year to come, and we at BMC want to be here with you if you're experiencing any of these symptoms and want to help you get to the other side with us. So thank you again for having us, and have a good night.
Thank you. Come on, let's give our panel a big round of applause. We want to say thank you to each and every one of you. I want to thank our partners at BMC, Trina, Martin, Cherry. Thank you so much for the work of your team, and we thank God for you. We're thankful to each and every one of you who have joined us, those who will watch this live at some point today or watch as a recording later this week. We ask that you share this with someone. Let someone know about this information. We're so thankful that we're continuing to be a church that informs and empowers. And as we've continued to say throughout this whole pandemic, we're choosing healing over hurt, and we're choosing Christ over COVID. So with that said, we won't keep you any longer. I know you want to get to your dinner, get to your families, but I ask that you join us as we close with a word of prayer. Dear Heavenly Father, Lord, we thank you for this time together. As we've learned, as we've grown collectively, as we've thought about long COVID, and as we've discussed the symptoms and we've discussed the ways in which we can address this moving forward. We thank you for each and every one of our panelists and for their expertise that they brought to us on this day to help encourage and empower us as a congregation, as a community, as a city, and as a commonwealth. But God, we're praying that in this moment you still speak to those who are dealing with these issues, those who are still recovering, those who are still hurting, those who are still trying to figure out what's best for their life and their health. And God, we're just praying that you help bring about healing in our world today. And so we're asking that you continue to give us hope and a future. And we're thanking you for this opportunity to share with one another. I ask in this moment that you continue to provide the resources, continue to provide the expertise, continue to provide the wisdom so that we might be good neighbors to one another. And I pray that you be with those who are still in the season of mourning and encourage those who are still looking to move forward in their lives. God, we know there's still a balm in Gilead. And so we trust in your healing power because you do heal the brokenhearted and you can mend those who have been hurt. So bring us through this moment because we truly believe that though weeping may endure for a night, joy does come in the morning. And so we have faith, we have hope, and more importantly, we have love. Be with us as we leave this virtual space, and we ask that we never ever leave your presence. So now unto